I'm Dr. Tekchandani. I did my MBBS from Sage JS Medical College and KM Hospital, Mumbai. I did my post-graduation from the same institute in the year 1984. I resigned from KM Hospital as a lecturer in the year 1985 to start private practice. So from 1985, I've been in practice, and this is my 40th year of practice. I've seen a lot of changes in the pathology practice. Initial years, when I was practicing, everything was done by manual methods. And now there is a lot of automation has come in. There are a lot of machines which do all the testing. The quality control is also done by artificial intelligence. Initially, we used to type reports on the typewriter. Now they're all laser printed, send on email, send on WhatsApp. So there have been a lot of changes. But there has been one field which I feel there has been no change at all, and that is in the light microscope. So the light microscope is still the same, and I have used that microscope for 35 years. But the last 2-3 years of the microscope, I started getting severe neck ache and back pain. When I see into this microscope, you can observe my back has no support and my neck is bent forward. So when you're doing this continuously, the back muscles go into a spasm, and that can be very discomforting. So that is the reason I started to look for an alternate. With the result, I was on medication all the time, very irritable, not able to perform properly with repeated visits to my orthopedic surgeon. Ultimately, he told me, if this continues, you have to give up your practice. And then I became so desperate, I started looking for alternate solutions. I did find microscope with cameras attached, but I was not happy with them. Till someone gave me the contact for Cilika microscopes. And I contacted Mr. Samrat, and he arranged a demonstration for me. I was so happy with that microscope that within 6 months, my backache, my neck pain, everything disappeared. Not only that, I started performing much better. I was taking half the time what I was usually taking. So I started using the Cilika microscope. And as you can see, when I'm seeing into the microscope, my back has got full support and my neck is straight. With the result, I can work much faster, and what used to take me 1 hour, I finish in 30 minutes. Therefore, I have much more time to devote to other activities in the laboratory, and it has really helped me physically in improving my health. And my staff is very happy because they now see me always cheerful, no grumpy face, and they love to be taught with this microscope. Similarly is my juniors, and if I have any discussion to do with my other colleagues, it becomes very easy. There was a 100% improvement in my turnaround time. With the result, I had more time to look at other aspects of my laboratory, and I had time to interact with my patients, talk to my staff. That was the first biggest advantage of Cilika microscope. And later on, I realized that there are many other things I could do with it. For example, I began teaching my juniors. And since there was a visual display, I could explain to them better and they would be able to grasp faster. If I had any difficulty, I could send the film, the videos, the pictures across to my colleagues. We would discuss the case and come to a diagnosis without their being here at all. So it has really helped me in my practice, in my physical health, and in my teaching and giving a better output.